Hi, I'm here with the Chicago Department of Public Health on behalf of the CHAT program, Chicago Healthy Adolescents and Teens. In this program, we bring a similar presentation and offer no-cost testing for sexually transmitted infections to places like high schools around Chicago. Today, we're going to talk about sexual health. First, we'll go over sexually transmitted infections, then we'll talk about pregnancy. We are not here to judge you. We just want to give you the facts. And we believe this information is important for everyone. It doesn't matter if you're sexually active or not right now, how often, or who you're sexually active with. It's important that you have all of the information to make choices that are right for you. I'll use the term STI, which stands for sexually transmitted infection. You may have also heard the term sexually transmitted disease or STD. STD and STI mean the same thing. Now we just use the word infection instead of disease. This presentation focuses on two STIs, chlamydia and gonorrhea, because those are the two infections we test for in the CHAT program. Gonorrhea and chlamydia are pretty common among young people. In Cook County, where Chicago is, we actually rank number 2 in the entire country for the number of chlamydia and gonorrhea infections. In the state of Illinois, if you're 12 or older, it's your legal right to get tested and treated for STIs and to get birth control completely on your own. You don't need anyone's permission and no one else has to know, not your parents, a guardian, or a caseworker. It's a lot to think about though, so if you have an adult in your life that you trust and can talk to about this kind of stuff, we encourage you to. So now, let's talk about how someone can get chlamydia or gonorrhea. Chlamydia and gonorrhea are passed through sexual activity. When we say sexual activity, we mean vaginal sex, anal sex, and oral sex, giver or receiver, or any time your genitals are in contact with another person's genitals, like if you're making out while your clothes are off. Gender doesn't matter. A girl and a guy, 2 guys, 2 girls, if someone has an STI, they can pass it to someone else they're sexually active with. You cannot get chlamydia or gonorrhea from masturbating, a toilet seat, sharing clothes with a friend, or kissing. All STIs, including gonorrhea and chlamydia, are 100% preventable. The best way to protect yourself from getting an STI is by not being sexually active. But there are other ways to reduce your risk if you are sexually active, and we will get to that later. Many STIs are treatable, which means you can take medication to deal with them. And some, including chlamydia and gonorrhea, can be curable, meaning you can totally knock them out of your body with medication. To cure chlamydia, it can be as easy as taking 2 pills. To cure gonorrhea, it can be as easy as taking 2 pills and getting 1 shot. For both, once you get treated, it's important to wait 7 days before having sexual activity with anyone so the infection is totally gone from your body. That's it. So how do you know if you have gonorrhea or chlamydia? The most common symptom of these STIs is no symptoms at all. With STIs, you may hear things like, you'll have bumps, it'll burn when you pee, it'll itch. But with chlamydia and gonorrhea, it's usually the exact opposite. Most people will feel totally fine and have no idea they're walking around with one of these infections in their body. That's why getting tested for these 2 infections is so important, because if someone has one of these infections, but they don't feel or see anything different about their body, they assume they're fine and don't get tested or treated. They can then easily spread chlamydia or gonorrhea to someone else without knowing it. Untreated for too long, these infections can not only spread to other people, but they can also cause a serious infection that can land you in the hospital. Women can lose the ability to get pregnant. Men can lose the ability to get a woman pregnant. These complications can happen to anyone with an untreated infection, no matter how old you are. And if you have an untreated infection, these complications can happen sooner than you think. If you are sexually active we want you to think about your own risk of getting an STI. Also, if you are having vaginal sex and you don't want to get pregnant or get someone else pregnant right now, you don't have to. There are ways to reduce the chance of both STIs and pregnancy depending on your situation. First, we encourage you to talk with anyone you are sexually active with. Having this conversation can be uncomfortable, and we know that. It doesn't mean you're accusing anyone of anything. Communication is part of a healthy relationship. One of the reasons that communication is so important is because even if you had an STI and got it treated, so it's completely out of your body, you can get it again if the person you're sexually active with has it too. You can reduce your chance of infection by using a condom every time you have sex. With vaginal sex, we also recommend using a condom plus another more effective form of birth control. We will go into more detail about birth control in a second. But before we do, we want to be sure you know that testing is the only way to know if you have an STI. Testing for STIs and getting birth control are both routine parts of healthcare. Condoms need to be used correctly in order to work properly and help keep you safe. Learn more about condoms at chataboutit.org/STI. Like we said earlier, we recommend always using condoms plus another form of birth control. You may have heard of some of these types of birth control, and they are all more effective than condoms at reducing the risk of pregnancy. We don't have time to go into detail about each of these now, but please go to chataboutit.org/pregnancy to learn more about whether any of these methods may be right for you. But we do want to take a moment to shout out these two methods of birth control known as long-acting reversible contraception, the IUD and the implant. These are the #1 recommended forms of birth control for teenagers. Many teens already have these and are really happy with them. An IUD is a small T-shaped device that goes in the uterus, and the implant is a small rod about the size of a matchstick that goes in the arm. They last between 3 to 10 years depending on the type. They're inserted and removed by a healthcare provider, and it's easy to get them taken out whenever you want. They do not affect your ability to get pregnant later in life. One reason teenagers like these is because they're completely out of sight, so nobody has to know if you have one. And they are super low maintenance, so once they are in, you're all set. You don't have to remember to take a pill every day, come in for a shot every few months, or anything like that. You don't have to think about them again until you want them taken out. Because there are many myths out there, and because people have different experiences with birth control, it's really important to talk this over with a healthcare provider. Just because your friend or your aunt or someone else in your life had one experience, it does not mean you will feel the same way. Emergency birth control is not like other forms of birth control we just talked about. It's not for regular everyday use. It's for emergencies only, like if you have sex without a condom or a condom breaks. Sometimes it's called the morning after pill. It includes Plan B and these other options. They should be used as soon as possible after unprotected sex to help reduce the risk of pregnancy. These do not cause abortions. You can buy Plan B at a pharmacy without a prescription or visit a clinic for other options. We hope you will explore our website, chataboutit.org. You'll find information on things like healthy relationships, sexuality, and more detailed information on birth control and STIs that we didn't have time to cover in this video. You can also find clinics close to you and other resources out there to help you. We have given you a lot of information, but ultimately, this comes down to you. You are the expert of your own body and your own life. Thanks for watching, and feel free to reach out to us with any questions at contact@chataboutit.org.